Hello everyone, and welcome back to our channel. I'm Vani, and today we're exploring the fascinating world of drug absorption through different routes of administration. By the end of this video, you'll be able to describe the various routes of administration. You will also be able to compare and contrast the maximum drug concentration, Cmax, and time to maximum concentration, Tmax, based on the route of administration. Drug absorption is a pivotal phase in the journey of a medication through the body. It involves the movement of a drug from the site of administration, traversing various biological barriers before entering the systemic circulation to exert its therapeutic effect. The rate, extent, and duration of drug absorption are crucial factors influencing a medication's efficacy and onset of action. The route of administration plays a significant role in determining these absorption dynamics. With over 40 possible routes, each method offers distinct advantages and limitations in how drugs are absorbed and distributed within the body. Understanding these routes is fundamental to grasp the diverse mechanisms that govern drug absorption. So, let's dive in and explore the different routes of administration and how they impact drug absorption. Parenteral administration refers to the administration of medications by injection or infusion. Examples of injectable routes include the subcutaneous route, which is injection into the fatty tissue under the skin, the intramuscular route, which is injection into the muscle, the intradermal route, which is injection into the dermis, and the intravenous route, which is injection into a vein. Drugs that are injected intravenously enter the systemic circulation directly and completely. However, drugs injected subcutaneously, intramuscularly, or intradermally need to cross at least one cellular membrane to reach the systemic circulation. Consequently, the time to maximum concentration can be delayed via these routes. When larger drugs, like proteins, are administered via the intramuscular or subcutaneous route, the movement across capillary membranes is often slow and most of the drug is absorbed instead via the lymphatic system. Unfortunately, proteolytic enzymes in the lymphatics can destroy much of the drug before it even reaches the systemic circulation. On the other hand, drugs administered via other routes have to cross several biological barriers to enter the systemic circulation. Common routes of extravascular administration includes the oral route, where medications are swallowed, rectal route, where medications are administered via the rectum, transdermal route, where medications are absorbed through the skin and includes examples such as creams and patches, inhaled route, where drugs are absorbed across the lungs, buccal route, where drugs are absorbed between the cheek and teeth, sublingual route, where drugs are absorbed under the tongue, and the intranasal route, where drugs are administered via the nasal passage. The route of administration significantly impacts both the rate and extent of drug absorption. The absorption rate is commonly assessed by monitoring the plasma drug concentration, denoted Cp. Cp represents the mass of the drug within the systemic circulation divided by the volume of plasma in that circulation, as seen in this equation. Understanding the journey a drug takes to reach the systemic circulation helps determine crucial factors like the maximum concentration, or Cmax, and the time taken to achieve it, or Tmax. For instance, when a drug is taken orally, its pathway to the systemic circulation follows a specific route, initially starting in the gastrointestinal tract before moving to the liver via the hepatic portal system. In the liver, the drug will likely undergo first-pass metabolism. The drug is then transported by the venous circulatory system to the right side of the heart, then to the lungs before returning to the left side of the heart and being distributed via arteries. Due to the number of steps involved with oral absorption, orally administered drugs often exhibit a prolonged time to reach the systemic circulatory system and, consequently, the Cmax is generally lower and achieved more slowly than other more direct routes, such as the intravenous route. This illustration showcases the differences in Cmax and Tmax between the IV and oral routes of drug administration. Importantly, half-life remains the same given that it is a property of the drug and not the route of administration. Furthermore, when the same dose is administered via the IV and oral routes, assuming complete absorption for both, the area under the curve, also known as the extent of absorption, should theoretically remain constant despite differences in Cmax and Tmax. In reality, achieving 100% absorption into the systemic circulation from the oral route is improbable due to obstacles encountered during gastrointestinal absorption and the potential loss of the drug through first-pass metabolism. Thank you for watching. If you found this video helpful, please give it a thumbs up and subscribe to our channel for more insights. Until next time, take care and stay informed.